Perimenopause is a very interesting time in a woman's life. It's the time when the menstrual cycle begins to wind down into menopause. This is usually a 10-year transition. It doesn't happen overnight. Some women will experience the symptoms of perimenopause as early as their mid-30s, but most women experience it starting in their early 40s. The first symptom a woman will experience is a shortening of the menstrual cycle, from the usual 28 to 30 days down to 26 days, 21 days, or maybe even every 2 weeks. This is caused by the reduction of progesterone output by the eggs. When this is happening, I generally recommend some form of the use of the herb chasteberry. What chasteberry does is it increases the pituitary output of the hormone that tells your ovaries to make more progesterone. This can then lengthen the cycles for a period of time. It could be several months to several years. The next symptom that a woman can experience is increasingly heavy periods. This can happen concurrently with the shortening of the cycle or as a second symptom. With this symptom, you get heavier bleeds. Usually they're clottier, with more body aches, body pains, and breast tenderness. During this phase, what I like to do is balance out that ratio between progesterone and estrogen by increasing your metabolism of estrogen. This can be done using key nutraceuticals that include some form of diindolylmethane or indole-3-carbinol to make sure that you're excreting the estrogen properly. When you do this, you also reduce your risk of any of the estrogen-based cancers. Once you've got your chasteberry stimulating more progesterone and you've increased your estrogen metabolism, this can stabilize the period for a period of time, having relatively calm cycles for a while. Could be a few years, until the hot flashes set in. Once the hot flashes begin, what's happening is that the ovaries are ceasing to produce estrogen. When you don't have enough estrogen, that creates a lot of biochemical signals in your body, and the hot flashes start. You can calm down these hot flashes by using plant-based medicines called estromimetics. There's a whole class of these herbs, and for that, I can help you determine which ones would be the best ones for your body. They include herbs such as black cohosh, soy isoflavones, red clover, and dong quai, to name a few. That will get you by for another year or so of relative calm until the periods stop completely. Once you haven't had a period for 12 months, then you are in menopause. At this point, I do recommend a very small amount, almost a homeopathic amount, of plant-based bioidentical hormones. This will protect you from metabolic imbalance. Some of the symptoms of menopause include depression, memory loss, word loss, fatigue, and just feeling like you don't want to live anymore. Another important symptom to notice is weight gain around your abdomen and on your back. The reason that this happens is because the loss of the reproductive hormones creates a metabolic imbalance. Metabolic syndrome can lead to diabetes and heart disease. I'm excited to work with the perimenopause transition because there are so many things you can do using functional and plant-based medicines to ease this 10-year transition. You can literally change the trajectory of your body's path into menopause, which lasts for the rest of your life, and you can have a healthy menopause instead.